is Aisha Arias,
And my name is Franco Arias.
and on today's episode, we want to talk about healthcare around the world. So, the Olympics is right around the corner, and it has us on this mood of international and different cultures and trying to see the intersection between that and healthcare. So, we decided to talk about a few countries. In this case, we'll be analyzing two countries in particular and their healthcare and how does that compare to what we see here in the US. So in my case, I have Singapore.
And I have Costa Rica.
So we will be talking about our country. So I'll first be asking you about Costa Rica, and then we'll be talking more about Singapore. So um, could you give us maybe a little intro as to what you found interesting or maybe something that we should know just to get some context on the healthcare in Costa Rica?
Sure. I just a little intro on Costa Rica, and what we're doing today is not an in-depth
Mm,
analysis, but something that anyone could would like to know, especially if you're visiting.
yeah.
Costa Rica in my case is fairly close to the U.S. and so I have traveled there, and I know a lot of people have traveled to Costa Rica. So first of all, Costa Rica is ranked by the World Health Organization number 36, and is still a better they're in a better rating than the U.S.
Mm,
Life expectancy is 81,
wow.
and it's a system that in 1950 was not as good as it is today. We're talking about life expectancy in the 50s for any regular citizen in Costa Rica, 50, 51, and now it's 81. It's a remarkable number of years that they have advanced, and that's some of the fun facts about Costa Rica. It's a blue zone.
Mm.
If you have seen it, that the commentary, and so there is a lot of curiosity about the health system in Costa Rica. So I hope that this information that we will be giving triggers you to find much more information about the system.
Yeah. Okay. So my first question would be, how does a normal person or like a citizen of Costa Rica pay for healthcare? How much does going to the doctor cost in Costa Rica?
The healthcare, it's free
Mm.
in Costa Rica. There is this private and public healthcare system. They work together. Both of them are excellent and pretty good. So anyone could go if you're a citizen or a legal resident, you are entitled to go for free to to all the levels of care. There is a difference. Maybe we could talk about it, but that's answering your question. It's free.
Okay. What about for tourists or people that are don't live in Costa Rica?
Well, if you need to go to the emergency room, no matter who you are admitted,
Wow.
and it's free for you too. Now, when you're a tourist and you need to see a doctor for something other than the emergency room, then you need to pay,
Mm.
right? And there are different options for that too, right? And so Costa Rica has an excellent relationship with the U.S. So if you are a U.S. citizen, you're going to find some benefits in the health system there too.
Okay. So the next question would be that what are the benefits, or how does a U.S. citizen pay for medical care in Costa Rica?
If Interestingly, if you're a veteran, that insurance is it's covered. You're covered there in Costa Rica,
Wow.
and they take private insurances from the U.S. too. And even if you're not from the U.S., they also take international health insurance. And so that's pretty interesting because they do have a system that allows for that.
Mm.
And even if you don't have the insurance,
Mm.
the cost, out of pocket cost, it's really low. I mean, I mean, something that could cost here in the U.S. $20,000, it would probably cost $2,000, $4,000. I mean, someone that went to the emergency room, right, in the U.S. Uh, paid $20,000. Over there, he paid $100. And I mean, and it's the same number of people used, the X-ray or the scanner, or the blood work that they do. It's just comparable, the same thing, same number of professionals involved, and look at the price difference. So even if you don't have insurance, it's still doable.
So what would you say is something characteristic of Costa Rica in the way that they do healthcare?
So apart from being free, which is something that everyone will find very attractive and interesting, the system is designed in a way that not only they have the resources, but everyone is involved, right? So, for instance, if you want to study medicine there, it's free, right? It doesn't cost you, but they require you to work for 3 years in a sort of a repay situation, and that works out pretty good because, again, for the system to work, you need to have enough healthcare workers. And so another part of that is interesting, that they have this preventive medicine approach, and so they ask people or companies, organizations to stop to do exercise, and also they send staff workers, healthcare workers, to the different regions, and so every person is accounted for. If you're in a serious health situation, and they will check on you at least three times a year.
Wow.
And then the next group gets checked out 2 times a year, and then the regular person will be checked out at least once a year. And so they keep your records up to date. And I don't know any other country that has all the citizens accounted for in terms of their health data. I think it's a very interesting data to have for any research in healthcare, that every person in the country, it's accounted for, and they know at least once a year someone from the healthcare system is visiting and gathering that data.
And they go to the houses of each of these, of everyone.
Yeah, especially those people that live in rural areas. You'll see these people in motorcycles, and they're healthcare workers visiting these people, and they know. I mean, that doctor, that nurse will know their patients by name, because there are so many regions, and the system has enough people to get to those areas, right? And they have small clinics in the cities, and people in different in neighborhoods, they had to go to that clinic, and it's not overcrowded because there's just enough for every part of the city. And so, and it's organized. They had to go to visit the clinics in the city, and they do it in a way that it's just not crowded, right? And people go. It's free, and you want to go. So I think it works. I mean, from 51 to 81. I mean, that tells you something that is working.
Yeah, that's really interesting. So, maybe just coming to a close with Costa Rica, what do you think are some of the challenges to Costa Rica's healthcare system?
Well, if you have watched the news, you'll see that Costa Rica is part of this immigration corridor, not only from South America, but from all over the world. People just before Costa Rica, they enter through a place here in Panama, which is really difficult to go through. But you know, this system is designed for at least 4 million people, but beyond that, I know that the intention of the immigrants is not to stay in Costa Rica, but just passing through, it generates, something to the system that is not prepared for such a big amount of
Yeah.
people even passing by.
Mm.
So that's a challenge, definitely.
Yeah, because I mean, I've heard stories of there's so much that they live through the trail or through that path, that they get injured or sometimes even bitten, from like snakes or spiders or whatever animals they encounter, women that give birth along the way, people that pass away as well. So many health concerns that are happening. And even though they might not stay in Costa Rica, maybe they might need attention, and it could sure put a strain on the system if it wasn't meant to care for more than their population.
Okay, so now it's my turn to ask questions about Singapore. And so could you at least let us know where this country is?
Okay, so Singapore is right off Malaysia. It's a small island, and when you look at the map, you see Malaysia, and it's like really long. And at the end of it, it almost looks like it's part of Malaysia. But when you zoom in, Singapore is its own island.
Yes. Yeah, and I know in that part of Asia there are a lot of islands,
Yes.
and so sometimes we hear news about these places. Some of them are so pretty,
Yes.
and so in talking about the health system, what can we find out about it? Is it completely private, or is it completely public? What's the story on it?
Yeah, so but one of the things that I found really interesting about Singapore in comparison to other countries is that it's not completely either or. So it's not completely public and it's not completely private. It's a mix of both. And the way that works is that the government has it has like a banking system that we could say, that it administers, or it created that bank, but it doesn't manage it. So in that sense, that's the private part. And every citizen, every person living in Singapore has to be putting money into that savings account. And so there's different ways that savings account is divided. And so there's an ordinary account, which is for school and housing and for other extraordinary costs that might come up. There's a special account, which is for retirement specifically. And then there's MediSave. That's how it's called. And MediSave, and that account is for medical expenses. And so it kind of works how we here in the US have also the HSA, the health savings account, which some of the companies also contribute. In the same way it works in Singapore. So the government says, out of everyone's wages, a third or X percentage has to go into HSA, or the health savings account, and employers also contribute the same amount. And so it's the employee and the employer all contributing. And so then after that, the part that comes out more maybe public of the Singapore health system is that Singapore is able to, because it manages the bank, in essence, they are the client of the hospitals and of the doctors. So they have all the bargaining power, or they have a lot of bargaining power to be able to bring down the cost of healthcare. If it were up to the individual, not you go in as yourself, and it could be a lot more expensive. But when you pull in all these people, and especially the whole country, they're able to do that part.
And so I guess that's how it is maintained, right? Is there any other point that we need to know about this whole how the system is maintained through the years?
Yeah, so it's a really complex system. But in essence, that's the way that it's maintained. And so when you look at Singapore, their their distinction or the characteristic that they have is that they want to instill a culture of personal responsibility in each one of its citizens. So for that reason, they didn't want to have a public healthcare system because they wanted to make sure that everyone knew that there were costs to healthcare. But they had tried going into just free market way of providing healthcare. And in the beginning, when Singapore, just like in Costa Rica, Singapore also in the 50s was a very poor country, and it had a really high mortality rate. People didn't live very, very long. And after some years, Singapore started to increase or get better in their economy and as a country. And already by the 90s, they started to seriously look at their healthcare system and try new options. And so while they were trying to find their style of healthcare, they started off with just having kind of a free market for hospitals, kind of how we have here in the US, where hospitals can put their own prices to things. And the idea is that the competition will be able to bring down costs for the individual. And they found out that that doesn't really work. So the free market system does not work in healthcare. The government does have to intervene because if not, they started to see that hospitals started to buy really expensive equipment and renovating their equipment without need. That was starting to drive up costs. They were starting to increase the salary of their doctors. They were spending on different like really expensive rooms so that patients that were with more money could pay for those services, and putting the rest of people in really bad conditions or waiting lists. And so the government said, no, that's not gonna work. And so that's how they got to the current system. So there is a level of government intervention as to the costs and everything, but everyone is contributing to savings and also being responsible in that way. And so when you need to go and get a checkup or go to a doctor or anything or get a procedure done, it comes out of your savings account.
It seems like an excellent system. And so I mean, I'm just assuming that, the numbers are pretty good. Like, what's the life expectancy, or do you have any numbers on the mortality rate, or, stuff like that?
Yeah, so life expectancy is 83. And the world average is 72 in comparison, and in the US it's 79. So pretty good. Infant mortality, 2.1 per every 1,000 births. And in comparison with the US, that we have 6. Worldwide, the average is 20. So it's a lot higher worldwide, but really low for Singapore. Yeah, and level of efficiency, it's number 2 in the world. So that's also really good. It means that people don't have to be on waiting lists or wait too long to get treatment.
Yeah. It seems like a very efficient system.
Yeah.
Do you have any numbers about the efficiency of the health system?
Well, I mean, just as like wait times or whatever, I don't, but I also have how much they spend on GDP for their healthcare system. So, just for numbers, right? The U.S. spends approximately 17% of our GDP goes into healthcare, and Singapore only spends 4%.
Oh my goodness!
Yeah, so there you could see that it's an interesting public-private mix, and yet it doesn't spend that much money as the U.S. does, and yet it has a really good and efficient healthcare system.
And so, what would be the challenges that you could see
Mhm.
in the system ahead?
Yeah, so the challenges are coming from within. So in Singapore, they're starting to see that the number of childbirth is decreasing, and they're afraid. While a lot of countries that's starting to happen,
Mm.
and in Singapore, they're already starting to see that the projections for the upcoming years is that it's just gonna keep decreasing, and that's difficult because even though this system isn't here in the U.S., for example, healthcare or social security, which might be the closest thing that we have, is based off younger people working,
Mm.
right, and older people or that are in retirement are using the funds, but that are coming from the younger population. And when you have an inverse pyramid in childbirth, that becomes an issue,
Mm.
right? We're seeing that also in the U.S. In Singapore, it doesn't work that way. When you grow older, you actually have to contribute more to your Medisave, the medical account, because your healthcare is more expensive. So why is that still an issue?
Mm.
You might think I was thinking like, okay, so why does childbirth have anything to do with their system?
Mm.
And the thing is that when there's a family member that has um like a bigger illness or needs a specific treatment that might be a little bit more expensive than just a regular doctor's checkup, the families pull together from their Medisave accounts, and that way they pay for the remaining that person might need for the rest of their treatment or procedures. And so when the family starts to shrink, where does the pooling come from, right? And so that's where Singapore is starting to um, worry, and they already have some plans in place. So they already have they're giving out money to families that are with their first child. I think it's like $6,000. And then for the second child as well, I don't know if it's like 6,000 or $8,000 for having that child, along with other help. I think they also provide or they subsidize part of like childcare for the families. And in that way, they want to incentivize families to start having families.
Right.
Yeah.
Mm. Well, interesting. I think it's a great mix of things that they have.
Mm.
Um, you have mentioned that they have tried that type of open market, and it didn't work. And I'm pretty sure that this is also something that they try and see if it works.
Yeah.
And I don't think that nothing could be written in stone in this type of system. It has a lot to do with the culture
Yeah.
too, right? I don't know if that you have seen that in the case of Singapore.
Yeah. Yeah, I think for one thing that I rescue maybe from the both of our countries is that they kind of went through the same issues or difficulties. They weren't countries that were coming from good economic standpoints, and it took them a while to be able to get to the systems that they're at right now, but they're not set in stone, as you said. They're still innovative and relatively young in the ways of wanting to continue to innovate and find better ways to care for their citizens and provide quality healthcare to them.
Great, great. So overall, I think this is what we wanted to share today.
Yeah.
Summarizing Costa Rica free healthcare system, right, which is also a combination of private and public. And of course, when you have a free system, you have a longer waiting list. But the system is there and it's available. And if you need to expedite your treatment, you are also free to go to the private health system. The hospitals are pretty good, and they're not overpriced. And so the same with Singapore, people are encouraged to save
Mhm.
And so I guess that's the cultural part that the caring for the elderly. It's a little bit different in the Asian culture,
Mm.
and I think that preparing for that is also part of this cultural heritage
Mm.
that they have.
Yeah. 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 So thank you so much for also sharing with me about Costa Rica. I really enjoyed learning about their healthcare system. And I hope you all enjoyed also listening. And if you're watching this video, watching us on today's podcast, and we hope to uh, continue the conversation with you guys. If you know of any other healthcare systems or you're currently living in another country and want to share some tips or some things that you enjoy about your healthcare, please leave them in the comments below.
Thank you.
Thank you.